Okay, good afternoon and welcome to the Medical Association's first fentanyl and opioid update. I am Julia Boothe, the president of the Medical Association for the state of Alabama. Fentanyl is a synthetic opioid that is 50 times more potent than heroin and 100 times more potent than morphine. Just 2 milligrams of fentanyl, which is equal to about 10 to 15 grains of table salt, is considered a lethal dose. According to a report from the Gulf Coast High Intensity Drug Trafficking Areas Program, fentanyl overdose deaths in Alabama skyrocketed 136% between 2020 and 2021. According to the Alabama Department of Mental Health, there were 417 admissions into treatment centers for the abuse of fentanyl in 2021 compared to 150 admissions in 2020. That is over a 170% increase. As Alabama is experiencing this surge in fentanyl overdose deaths, we felt that it was important to discuss the dangers of illicit fentanyl, treatment options, and more. Today, we have quite a few experts in the field with us, and joining me are Richard Tucker, a consultant with the Drug Education Consulting Group, Carrie Wimberly, Executive Director of the Addiction Prevention Coalition, Ian Henyon, Executive Director of the Birmingham Recovery Center, and Dr. Darlene Traffanstedt with the Jefferson County Department of Health. Welcome to our panelists, and thank you all for being here with us today. To begin with, I'm going to have Richard, who is a law enforcement and drug addiction consultant with the Drug Education Consulting Group, where he shares 35 years of experience and intelligence to clients in the public and private sector. He has also held many positions with the U.S. DEA, including special agent, group supervisor, and deputy assistant administrator. From 2000 to 2003, he served as co-chair of the DEA Intelligence Committee on Narcotics. This committee assists in the identification and dismantling of international drug trafficking organizations. Rick, please feel free to take it away.
Thanks, Dr. Boothe. I appreciate it. As we talk about fentanyl and the status of illicit fentanyl, so I'll frame my conversation about, I'm talking about illicit trafficking in fentanyl, the Schedule II medicinal fentanyl. I'll leave that for the medical professionals to talk about. So as we saw COVID coming upon us 2017, 2018, fentanyl had supplanted heroin as the opioid of choice. There's always been a problem with the illicit user in America. They haven't quite known how to quantify powdered fentanyl. So we saw massive overdoses. In 2005, when I was working in the Chicago division, we had 11 people die in about 30 minutes one morning. And in a wiretapped conversation, one of the traffickers told his source in Mexico, I asked him the question, what's the difference between a nanogram and a milligram? And so as they were cutting fentanyl into heroin, they were using about 1/4 milligram. And so they killed 82 people nationwide that day. There's always been this problem. As we saw fentanyl explode, then COVID hit, and we all kind of locked down. There was no international trade and travel. So we saw all kinds of scrambling around in the illicit community to try to get COVID. Then as we started to crawl out of COVID in that 2020, 2021 timeframe that Dr. Boothe referred to, as we saw the Asian traffickers and we saw the Latin American trafficking organizations, which were dealing illicit fentanyl. They began to funnel fentanyl back into the states. The Department of Justice said last week that on the border, and they had been around 10 million tablets seized. So law enforcement always says we seize 10% of what we actually are seeing. So if they seize 10 million tablets, we're probably seeing 10 times that much in the states. But to try to control that overdose, not because they're moral or ethical, the traffickers have tried to keep their customers alive by teaching them how to use it more efficiently. So now we're seeing these blue counterfeit pills. They're called the dirty 30s. They look like roxycodone tablets. For those of us they know about the medical community, they're half scored on the back. They have a 30 on one side and M on the other. We're seeing those come across in quantities of about 500,000 per bag. And the drug trafficking entities in Mexico are also controlling the migrant population at the borders. They're actually pushing the migrants towards illegal entry, so the migrants will have to pay them a $10,000 entry fee in some cases. But you get a half price if you're willing to carry across the backpack with 500,000 or 1 million pills in it and give it to somebody on the other side. So we're being covered up in these counterfeit pills. We're also seeing them counterfeited into alprazolam bars, or look like Xanax bars. And we're seeing those. And I think the reason it is, and from the analysts I talked to at DEA, it's because both the Dirty 30s and Xanax have obvious places to break the tablet. So it's easy for them to make it smaller to scrape off what they need. And as Dr. Boothe said, you only need a microscopic amount to get that euphoria that you want. So you're getting a pill that's being broken. And if you get stopped by law enforcement, you can always try to say it's a prescription drug. DEA is seeing some of these counterfeit pills on the West Coast, especially the alprazolam bars, that are a mixture of fentanyl and methamphetamine. So the user's getting that old speedball effect. Heroin addicts have commonly used heroin and cocaine at the same time. And so we're seeing that in these pills. So we're seeing millions of these pills around. The novel psychoactive drugs that were used when there was a lack of fentanyl are about 1,150 in variety. They're opioids, they're benzos, they're stimulants, they're cannabinoids that are out there. Some of those have taken effect and the users like them a lot. One of those that have just been made Schedule I by the DEA are the Nitazine brands of opioids. There are 8 analogs of that. There's butonitazine, etonitazine, isonitazine. They're about 10 times more potent than fentanyl, if you can imagine that. These are drugs that were given to the FDA back in the 50s and 60s for pain medication. They were too volatile. The dose was too small. They were just too prolific. So we're seeing this being remanufactured now by domestic traffickers, and we're seeing that done. The users on the street are very cognizant of the fact how strong this stuff is. And so they're sometimes they're even lying to their customers and saying, oh, it's fentanyl. So they're not scared of fentanyl. We're now seeing counterfeit pills with this nitazine in there. The nitazine is reluctant to respond to Narcan. So EMTs and emergency workers are having a hard time with that on the street. So we're seeing the fentanyl adulterated now with a drug called xylazine, which is a veterinary drug used on large animals. That's a sedative and a painkiller for those. That's not meant for human consumption. They're giving a wildly crazy euphoric effect to humans. But we're seeing xylazine both mixed with fentanyl, and we're seeing it mixed with imported marijuana from Mexico. So these are some chemicals that we're not used to dealing with. And so we're going to have to expand our horizons with fentanyl alone now. There are about 14 to 16 analogs of fentanyl out there. So when you think of fentanyl, it's not just your medicinal fentanyl in Schedule II. You've got about 14 to 16 different varieties of fentanyl out there. So in a medical setting where you've got a patient, you're prescribing them opiates, you want to make sure that you're not doing something that's incongruent. You might want to make sure that you know what they're taking. Your urine drug screens, when you're using those, make sure you can explore those novel psychoactives and make sure that the patient hasn't ingested something that they don't know they've ingested, for example, like the xylazine or some of the other supplements that are used with this and that. So that's basically the status of the way fentanyl is today. It's horrific. It's a horrific drug. It's overtaking the drug in America. 100,000 people died last year. There are going to be more this year. I can tell you that with pretty much good certification from DEA. We're going to see this problem grow. We're going to see other synthetics like nitazine pop up into our culture, and that's going to make it even more horrific. And to exacerbate that, we're now seeing an influx of Southwest Asian heroin from Afghanistan. The Taliban are back in control of the government. They have neither the will nor the resources to control the opium brokers in that part of the world. And so now we're beginning to see in major U.S. cities, we're beginning to see brown Southwest Asian heroin pop back up. So don't be surprised even in your communities if you start seeing some heroin abuse, some heroin being sold in those communities. So with that, I'll turn it back over to Dr. Boothe, and I'll be available for any questions you might have in the future.
Great. And just as a reminder, you can comment your questions in the Facebook Live and we'll address those once everyone gives some opening remarks. Next, I would like for Dr. Darlene Traffanstedt to speak to us. She is currently a medical director for the Jefferson County Department of Health in Birmingham, and she is leading the family planning program and the Health Equity and Population Health Division. She spent 14 years in the practice of general internal medicine before making a transition to public health in 2018. This transition was driven by a passion for working on health disparities and overdose prevention and response. And she's also a past member of the board of the Medical Association. Dr. Traffanstedt.
Hey, good afternoon, everyone. Thank you, Dr. Boothe. It has been an absolute gift to be able to work in the overdose prevention and response space in Jefferson County over the last 4 years. And during that time, we have seen essentially in the last 6 years, a doubling of overdose deaths in the United States. So in 2015, the United States had about 52,000 overdose deaths. And in 2021, we exceeded 107,000 overdose deaths. So I'd like for everybody listening in today to put that in the context of any other health concern or public health issue that we're facing today. And imagine, for example, if cancer deaths doubled in 6 years, or if a chronic disease like diabetes, amputations, or kidney failure doubled in 6 years. We would certainly be throwing all of the resources that we had at that public health concern, and that's certainly what we're doing. We here in Jefferson County have had a 70% increase in overdose deaths in the last 2 years. That's from 2019 to 2021, and a 233% increase in fentanyl deaths that same period of time. So 2019, we had 95 individuals that had a fentanyl related overdose death, and that grew to 316 last year. So far this year in 2022, we have lost 283 individuals to overdose death, with an additional 56 deaths that are suspected overdoses that are pending certification. And of those, 230 are fentanyl-related overdose deaths, meaning that 81% of all of our overdose deaths here in Jefferson County this year are fentanyl-related deaths. So for us, it is an acute crisis, a very significant proportion. I think if I could share anything with those listening today, it would be that I would really like for you to take the image that you have in your mind of an individual who might be at risk of overdose and wipe it completely clean. Because what we are seeing today in Alabama and Jefferson County, the rest of the country, is that anyone from anywhere of any age that purchases or obtains a substance that is not from a pharmacy or a healthcare provider's office is at risk for fentanyl overdose. So those are going to be your college students who are purchasing a stimulant in the library to help them get through finals. That's going to be your recreational substance user who may party with cocaine on the weekends. That's going to be your high school student who gets approached on Snapchat with the opportunity to buy Xanax, and that Xanax could be contaminated with fentanyl and cause an accidental overdose. So anyone that is obtaining substances outside of a pharmacy or healthcare provider's office, even if that looks like a legitimate prescription medicine, is at risk of fentanyl overdose as it is today. And so there just is really no safe medication use unless you obtain it yourself from a pharmacy or healthcare provider's office. So, those of us that wouldn't imagine that our family might be at risk, it is possible. It could happen to any one of us. We want to make sure people are aware of resources that are available. So here at JCBH, we offer free naloxone and free fentanyl test strips to anyone in the state of Alabama. That is in partnership with the Alabama Department of Mental Health and the Alabama Department of Public Health. Takes about 10 minutes to do training for naloxone or fentanyl test strips. About 20 minutes, you can do the complete training. And we will mail those to individuals anywhere in the state of Alabama through priority mail. So we would encourage, those that are willing to be prepared to reverse an accidental overdose to go out to our website and take advantage of that resource. There's also many other resources that are out there. There is a Never Use Alone hotline, a 24/7 helpline for substance use in the state of Alabama, a lot of other resources that I'll put down in the chat for those that are on the call to take advantage of. And I think I'll stop there, but happy to answer any questions that anyone has.
Thank you for that. And it's also sobering when you think, those numbers, we kind of get numb to hearing numbers, but when you think about it, every one of those is a parent, a child, a friend. I mean, that is a lot of Alabama citizens that we have lost recently. Next speaking us today is Ian Henyon. He is Executive Director of the Birmingham Recovery Center, an outpatient addiction treatment program located in suburban Birmingham. He is a licensed professional counselor and has been treating addiction and other mental health disorders since 2008. He attended the University of Georgia, too bad because I'm a Roll Tide person, but and he received a Master of Science degree in clinical mental health counseling from Prescott College. Turning it over to you now.
Thanks, Dr. Boothe. Yeah, what we're seeing here in the treatment side of things really tracks with what the other participants have said. And a few years ago, we were seeing people getting fentanyl and it showing positive in drug screens, but them not knowing that it was something that was usually in heroin. We saw that evolve to where people started seeking out fentanyl and using fentanyl as a drug of choice. But really the biggest problem where we're seeing recently is fentanyl being in other substances that they really weren't expecting it. And cocaine seems to be one of the biggest ones. I'm aware personally of 3 incidents involving cocaine and a related fentanyl overdose. And 2 of those incidents did have a death involved, and one of them involved a very serious overdose. And so to be purchasing anything again that's off of the street, that's not from a medical practitioner, is just a dangerous thing to do. And when it comes to treating addiction, I don't necessarily think we get a lot of effectiveness in trying to scare people. However, fentanyl is being cut into everything. And again, just to reiterate, and I think it was already mentioned a couple of times, but it is being cut into these fake pharmaceuticals. And so people who think that they are buying Xanax or buying roxicodone, and they think these are pharmaceutical medications and think they are safe, they are not safe. And when they are manufacturing these fake pharmaceuticals, they aren't doing it with an eye towards quality. And so you might get more fentanyl in one particular pill than another, which makes it even more dangerous. And so I guess what I would leave with you all is if someone is using substances, treatment is effective. There are options out there, and now is the time definitely to be looking at doing something different with your life.
Thank you for that. Next up, we have Carrie Wimberly. She's the Executive Director of the Addiction Prevention Coalition with over 25 years of leadership in communications, systems, project management, and grant management. This experience, combined with her family's multiple battles with substance abuse disorder, allows her to a unique lens through which she now leads a successful awareness program, prevention and connection nonprofit in Birmingham, Alabama. Discovering creative ways to connect with today's youth and to encourage them to make healthy life choices that protect their future is Carrie's personal passion and mission. Carrie, take it over for us.
Thank you so much for that. So at Addiction Prevention Coalition, we do primarily focus on awareness, prevention, and connecting people to resources. And as everyone has already stated, with this public health emergency, we are really focusing all of those areas on this particular issue. Working with students, we have student prevention groups in high schools. We're doing work in elementary and middle schools as well, but this is a topic that we're covering with our students and encouraging them to be able to educate their peers. One of the groups that we most like to get in front of are parents. And so every time we're able to talk and speak in any capacity where there are parents, we do education on this topic right here, because it is critically important for the parents to understand what's going on out there so that they in turn can educate their students, their youth, their children, because the children are being exposed to it greatly with their peers, but especially with social media. So what we encourage parents to do is to think of education as power, not to be afraid of what's out there, but to go and to research and to learn so that they can have these really great conversations with their kids. When the kids realize that they really do understand what's going on, they're much more likely to have those conversations. And we know, and we encourage and tell parents this because they don't believe us, but parents are the number one reason that their children choose not to drink underage or use substances. So, I mean, I've had teenagers and a lot of you've had teenagers, and we think they're not listening to us anymore, but they really are. So we encourage parents. We've got a website, apcbham.org. We have lots of resources for parents there, both parents that are looking for prevention information and talking points as they're talking to their kids from preschool all the way through college age, but also for parents who are struggling with a son or daughter who is using and is in a progression of substance use disorder, and resources for them. So we're just encouraging people both to get educated as parents and also Narcan training. We spend a lot of our time and resources educating people about Narcan, and Jefferson County Department of Health has made it easy for us by the online training. So it doesn't take but a few minutes, and we all need to do it because we never know when we're going to be in a situation where we can save somebody's life.
Right, very true. Now, as we wait on some of the other questions to come in, we do have a few, and I'm just going to ask the question, and if y'all just, pop in and answer where you think is appropriate. One of the first ones we have are, what are the signs of a fentanyl overdose?
I'm happy to take that one. So the sign of an opioid overdose, fentanyl or other opioids are going to be the same. So you're going to have someone that is unresponsive. They may not be breathing properly or breathing at all. They may have discoloration around their lips or fingertips. But one of the hallmark signs is going to be pinpoint pupils. And so if you see someone that's down and you can raise their eyelids and shine your cell phone flashlight there, if those pupils are tiny, like the point of a pin and not reactive, then that is there is a very good chance that could be an opioid overdose. I want to remind people that there is no risk in using naloxone or Narcan in someone who is down from something other than an opioid overdose. It will neither help them nor hurt them if they're overdosing on a non-opioid substance or if they're down for some other reason. So if you have Narcan, you see those signs and symptoms, there's no harm in trying it.
That's a great point. Very good. And then let's see, one of the other ones. Let's see, what would you say are signs of a fentanyl addiction or someone who's repeatedly, intentionally using?
Well, addiction, like a lot of disorders, it looks the same whether or not it's an addiction to opiates and fentanyl, or it might be an alcohol addiction. But really, you're looking at someone who has oriented their lives towards using a substance, and so they're spending a lot of time to acquire the substance and then to use the substance and then to recover from it. And so if you're devoting that sort of time to using substances, there's a lot of areas in your life that are going to get neglected. School, work, relationships are going to be neglected. And then certainly using substances is not an inexpensive endeavor either. And so you're going to see money and financial issues come up as well. And then we certainly see mood related issues where people are sleeping all day and perhaps not a great mood when they wake up, and they're just saying that they're tired and stayed out too late, that type of thing.
Right. Is fentanyl safe if prescribed by a doctor?
Yes, so there are two forms of fentanyl. There, as Rick referred to earlier, there's prescription fentanyl, which is a controlled substance produced by pharmaceutical companies and safe when properly prescribed by a provider. So it's typically used for very severe long-term pain in individuals who have been on opioids for a long time. So they're very tolerant to opioids. So think about your patient that has metastatic cancer or some other terminal pain related condition. The other place that it's used is in induction of anesthesia or maintenance of anesthesia. And the reason it's safely used there is because those individuals are being monitored, their oxygen saturation, their respiratory rate, their heart rate, and resuscitation equipment is available if needed. So when you take an individual, I think Ian mentioned cocaine, you take an individual who's very used to using stimulants, and then you add just a touch of fentanyl in there. They are essentially opioid naive, and it takes a very small dose to cause a fatal overdose in someone who's otherwise completely unsuspecting that they're getting an opioid. And so that's why this, has recently, the illicitly manufactured fentanyl has recently caused so much damage.
In the illicit market, I've seen a minuscule amount of pharmaceutical fentanyl being sold on the street. It has to be something that's stolen, and it's readily traceable. The fentanyl that we're seeing and the fentanyl that illicit users are dealing with are one of these analogs of the novel psychoactive variety, not the prescription fentanyl. So you're not seeing somebody selling Duragesic patches on the corner of the street. You're seeing powdered fentanyl, or you're seeing these counterfeit pills.
And I'd add, Dr. Boothe, that illicitly manufactured fentanyl is cheap to make. It's easy to make. The components to make it are very readily available to these criminal organizations. And so for them, it's, a business opportunity. For us, it's, harming our family and our friends. And so, they're not dependent, it's synthetic, so they're not dependent upon a plant to grow to produce the drug. And in these labs where these are producing it, it's not like we have, science trained individuals who are producing this or putting it together with other substances. So there's just no way to be sure it's safe. And even with fentanyl test strips, which we are currently distributing, we talk about the chocolate chip cookie effect of pills that are contaminated with fentanyl, where one side of the pill will have more fentanyl than the other side of the pill. So you really have to test the whole pill to be sure. So, you got to think about the way these things, the illicitly manufactured fentanyl is being made and how it's just unsafe from beginning to end. It really is.
And as a cautionary tale to friends and family members that are dealing with somebody that's probably using illicit fentanyl, it only takes a microscopic amount to overdose. And so we're seeing law enforcement officers and first responders that are in an environment that's rich, full of fentanyl in the air. We're seeing those folks overdose because of that. There's some urban myths out there about absorbing it through the skin. I think that's very hard to do, but it doesn't take much to ingest some by breathing it or by putting it in your mouth. And now that we're getting back and becoming social again, we're seeing a lot of people, especially young people, sharing vaping devices. And we're seeing that used as a delivery mechanism. So if you're vaping with somebody, a lot of urine drug screens are coming back. I talked to a lot of folks who are doing urine drug screens, and you're seeing multiple drugs show up in somebody that aren't really congruent with what they're abusing. What's happening is they're sharing a vaping device or a water pipe with a friend in a social environment, and they've ingested drugs and used that in that vaping device. So that's one of the questions you might want to talk to your clients and folks about is, are you sharing any devices with anybody? We always know about sharing needles, but now we're having to talk about water pipes, and we're talking about vaping devices also.
Right. And is there any, and we have another question, is there any formal classroom resources that are available to teachers or school administrators? And are there any specific programs maybe for teacher groups or educators to help them with this as well?
There are resources out there. If they want to contact us at APC, we can help connect them to those resources. There are free programs for elementary, middle, and high school that have lesson plans in there, and would be glad and happy to connect the teachers to those.
Great. And we'll just link those resources and websites in our comments.
Okay.
The last question, or another question that I have on here is how is fentanyl different from other opioids? Some of that Rick kind of talked about in the beginning, but what are some other specific things you all can think about as far as how it's different?
Well, I'll speak from a non-medical and illicit point of view, and then I'm sure the medical professionals can deal with it a little bit better than that. But it's the speed that the user gets for the required or for their euphoria that they want to experience. This stuff is so strong, it hits the receptor so fast, they're put in that state of euphoria, or however they want to do it. If you take a heroin user, it takes amount of time for them to get the euphoria from the heroin, but with fentanyl users, they're almost getting an instantaneous euphoria from this stuff, and the more instantaneous euphoria, the more they want to do it. It goes back to what Ian was talking about addictive behavior. It just kind of snowballs in that. So I mean, that's a non-medical sign, but that's the user perspective. They want speed and efficiency, and that's what they're getting when they're using fentanyl.
And Dr. Boothe, I think you referred to it at the very beginning of the meeting today, is that, you know, it's 50 to 100 times more potent than morphine and heroin. So strong at such a small dose. I always like to put it into real world examples. If anybody has had surgery before, and right before they put you to sleep, they give you medicine in your IV that makes you feel, I mean, you're still awake, but you feel like you're floating, or you know, they'll sometimes tell you something like, imagine you're in a happy place. And then, you know, you have that feeling that comes over you before you go to sleep. And that's typically fentanyl that's giving you that feeling. And so it's instantaneous. As soon as they put that medicine in your vein, you feel that. And compare that to what you might feel if you had a minor surgery and you were prescribed an oral opioid like a Norco, for example. So if that might help, you know, those listening understand the difference between taking a legitimate Norco or Percocet and then taking fentanyl, and how rapidly it you know, the feeling comes on. But again, most of the people right now, and this may shift over time, but here in Jefferson County, most of the people that are overdosing on fentanyl are not trying to get high on fentanyl. That is not their goal. They're taking something else, and the fentanyl is contained within it. Now, as they get exposed to fentanyl over time, they may develop the desire to seek out fentanyl. But the ones that are dying in Jefferson County, that is not what we're seeing right now.
The Midwest HIDA just published a report where 500 people overdosed in St. Louis a couple of months ago. And the scary part of that is when asked by emergency room personnel, what did they take? 50% of those 500 people did not know what they were taking. So it goes exactly what the doctor said, is that they're doing they're in a social situation, or they've been sold a bill of goods that this is okay, that it's not going to hurt you. But that was a scary thought to me, that 500 people overdosed and 50% of them didn't know what they took.
Well, and for most people at some point in their life, they have borrowed a medication from somebody else, or someone has offered them some of their medicine. And, you know, 5-10 years ago, that was less of a concern than it is today. But today, you know, your college classmate, college roommate could have purchased something that they believe to be legitimate and offer to share that with you. And that could be your last decision you ever make. And so again, not to scare people, but just to make people aware that, you know, if you take a pill that you didn't see come from the pharmacy yourself, it could have fentanyl in it. That's just the reality that we're living in today.
I would encourage parents, especially with young people, to explore the DEA site, One Pill Can Kill. One Pill Can Kill shows these pills and shows what they look like in reality and shows what they look like in the counterfeit. You can't tell the difference between them. And that's the scary part. So if you've got folks in a situation where they're sharing pills, whether it be in a school or a social or a meeting environment with adults, you can't impress this enough. If it didn't come from the pharmacy and it wasn't prescribed to you, leave it in somebody else's pocket.
And the social media piece for teens is just the worst. And so that's another, you know, piece of the puzzle. I know parents are trying to get their hands around the social media anyway, but you know, a teen can get on social media and in less than 3 minutes, you know, have made a transaction. And so many of their interactions that they're having, you know, online, which they spend a lot of time there and they're really savvy there, involve seeing images and pictures of drugs being available to them. So they are being bombarded with that. So, you know, that perception of risk decreases because of so many images. And that's another piece of that conversation that we need the parents to be having with those students, is just because you're exposed to it so often on social media does not make it safe, or does not make it be that everybody is using. That's another thing that the teens think, you know, all of my friends are using. No, they're not, you know, and this is something you gotta be aware of.
Well, and there is a percentage of the population that believes that it is okay to take medication that is not prescribed to you. And we try to educate the families of, you know, that you need to see a doctor when you need a prescription for something. Well, these situations and these counterfeit pills make that using of someone else's medication even riskier. And so just want to emphasize that do not take medication that is not prescribed to you, no matter what.
And you can't stereotype the user. We all tend to stereotype the user. These folks come from all ethnicities, all social environments, adults, children, young people, and they're using it. In my career, I've seen folks from every walk of life, from the rich to the homeless, that have the same thing that Ian talked about, those same characteristics of that abusive person that are abusing those drugs. And you'll see that in that. And don't stereotype. Well, it couldn't be my kid. It couldn't be that. I was told by Dr. Douglas Talbot, who was an addictionologist from the Atlanta area when I was a young policeman. He said, Rick, you're going to meet two kinds of parents when you talk to them about drug abuse: those that haven't been affected and they're ambivalent, and those that have been affected and they want to kill somebody. And he said, so the problem is that the audience you want to get to is that middle ground, as Carie said. And we want to educate folks that haven't been affected so they'll be prepared if they ever are.
One other question that we had was about rainbow fentanyl. Is it in Alabama, and what unique dangers does it provide?
It is in Alabama. It's in all 50 states. My personal opinion is that this is a passing fancy. I think it's not lost on me that it's here during the holiday season. It's not lost on me that it's a way to smuggling. It's being smuggled also in candy bags. We just seized about 500,000 pills in Connecticut last week that were in Skittles and Nerds bags, and that's the same color that they are. So I think it's a smuggling mechanism. I don't think it's specifically targeted at young people as being candy. These folks don't want to poison folks and without them knowing. They want somebody to buy something from them. So I think it's going to be the success of the smuggling of these pills. I think we're going to find millions more out there, but I do think it's a passing fancy, thank goodness, that we're going to see these colored pills come and go.
I wanted to touch on Rick mentioning xylazine earlier. Last year in Jefferson County, xylazine was involved in 11 overdose deaths, and this year so far 38. So we've had almost a quadrupling in Jefferson County of xylazine associated deaths, and xylazine was typically used it was typically mixed in with something else. So but xylazine is a veterinary medicine that's readily available too, and so another drug of abuse to really watch out for.
Right, and I'll just give each of our panelists just a couple minutes. If there's any other talking points you wanted to make sure that we got out today, please feel free to chime in and give any additional points you want to make sure that people go home with today.
Also, I did want to mention marijuana. That is such a common substance of use, not just with our teens, but with adults as well. And we're seeing marijuana laced as well. So, just because that might be a substance that some people have used in the past and feel comfortable with that, that's really dangerous territory as well. So just wanted to mention that.
that marijuana being adulterated with other substances is a marketing ploy. We've seen a lot of states that have legitimized it, saying it's recreational or transgenerational, it's legal. Basically, it generates tax for the state that legalizes it. That's basically it. And what they're doing is they're taxing that dispensary marijuana out of the economic forefront of the folks that are wanting to use it. So the cartels are now smuggling tons and tons of Mexican marijuana across the southwest border. And their selling point is it gives you a different high. And it goes exactly back to what Carrie said. They're using other drugs. We've seen fentanyl, which is unheard of. I mean, it's just not an economic move to sprinkle fentanyl, which is an expensive drug on there, but we're seeing a ton of it used with xylazine. And that goes back to what the doctor said about the overdoses there in Jefferson County, is that they're putting a lot of xylazine in this marijuana. So it's not just an opioid situation with xylazine, it's being polydrug, it's being mixed with a lot of stuff. So it's a dangerous and scary place out there.
And there was a question earlier in the presentation about what does fentanyl addiction look like? And what I would tell you is that if your gut tells you something is not right, then there probably is some kind of problem going on. And if you have questions about what is happening, please give us a call. We're happy to chat with you about what different options are. We're happy to meet with parents and spouses and talk about the specific situation and try to give you some direction, because this really is a complex issue, and certainly a 45-minute presentation on a Wednesday afternoon is not going to equip you with the tools to be identifying some of these things. But look to your resources to answer some of these questions. And again, if your gut tells you something isn't right, then something probably isn't right.
While the Medical Association for the state of Alabama, I speak to their physicians conferences 3 times a year, and I speak all over the country in all 50 states. It is being aggressively pursued and educated on that level. And there's some very smart people in the state of Alabama that are trying to tackle this. And some of those smart people are here today on this. And you have the resources, continue to work on those resources. We're never going to arrest ourselves out of this situation. It's going to be education and treatment is the only way that you're going to do this. And so I laud the state of Alabama and the Medical Association specifically for putting on presentations like this and some of the other presentations that I participated in them. It's outstanding.
Yeah, and I'll just finish by saying that naloxone is a bystander drug. You do not need to be a medical professional to use it. It should be wherever there's an AED or wherever anybody would be willing to perform bystander CPR. You should be willing to use naloxone. In the state of Alabama, all barriers have been removed to obtaining naloxone. So there's a standing order of the state health officer that would allow you to walk into any pharmacy in the state of Alabama and obtain naloxone. You would have to pay for it or use your insurance with your copays, deductibles, and those kinds of things. If cost is a barrier for you, our website offers it to anyone in the state of Alabama for free. We ship it out multiple times a week. It can get to you very quickly. Or we have individuals who need it right now that come here to the health department and we meet them down in the parking lot and give it to them. Or we have 17 pharmacies in the Jefferson County area that stock our free kits. So if you go to one of those pharmacies and you need it and can't pay for it, they can give you a free kit there. So there's no barrier. There's no reason why it shouldn't be available everywhere to anyone that might come across someone with an overdose.
And I will say, for those of you who have ever seen a naloxone box, they compress the box, and it comes in a flat container that'll easily fit in any mailbox. So there's no issue of having to sign for a large bulky package. And then you can just, flip your box back together and put your doses in there. And it also comes with a mask for rescue breathing if you needed that. So I thought that was very helpful, because like Darlene said, think of this like you do CPR. If you would go up to someone and you would initiate CPR, then you would be willing to go up and give them Narcan. So like I say, the barriers have been removed in Alabama, and now we're just trying to make sure we get the education out there. Thank you to each one of our guests for coming today. Just a significant wealth of knowledge was given, and thank you for your time as well. The people of Alabama appreciate each of you. Thank you again. Have a good day.
Thank you.